ICS, to me, means health and care partners working together across organisational boundaries to deliver person-centred health and care. With more local partners working together with a common purpose, we'll be able to connect better with our communities and get more in touch with the needs of our population, and to ultimately be able to deliver improved outcomes and reduce inequalities for those most deprived areas.
So the ICS is a fantastic opportunity to bring together a whole range of partners and stakeholders to really think about how we do things differently in health and care. It gives us a mandate and an opportunity to think outside the box, to take advantage of opportunities and to focus on the delivery of improvements to outcomes and quality in a way that maybe we haven't been able to do so to date. In Sutton, we have such a fantastic partnership already in place where people work together collaboratively in trying to proactively solve challenges and problems.
So for me, the ICS is about us working in partnership to make health and care better. It's about how we make decisions together that reflect the needs of local people who use health and care services. It's about how we bring in voices from right the way across health and care. So that's some of the organisations that we traditionally think of as health and care organisations, like hospitals, community services, social care and mental health services. But it's also about how we get the voice of our local general practitioners, our voluntary sector services, and organisations that work in the community as well, to make sure that the way we set up services is fully reflective of the needs of local people, and that we work together to tackle some of those challenges that we see within the health and care sector.
By working together, we can support people to live happier and healthier lives and to live more independently, and also to address those social determinants of health that we know affect and impact on people's lives. So things like jobs, housing, environment, education.
So in Sutton, I think this enables us to come together to think about those core challenges that we face and build on the partnership that we already have.
Having an ICS means that we're able to tailor services, and we're able to do this at a number of different levels. So some of our services need to be organised on a much larger scale. So for example, some of our elective pathways, we're working together across the ICS, across the 4 hospitals within the ICS, in order to make sure that we make sure patients are treated in the right place at the right time, that they're treated as quickly as possible, and that we share some of the valuable and scarce resources in terms of specialist staff, specialist facilities and equipment that we have across the system in South West London.
So in mental health, we have a really strong tradition of partnership working, and collaboration and co-production are absolutely intrinsic to everything that we do. The ICS offers us opportunities to extend that further and to also really raise further the profile of mental health and emotional well-being, and to support population level initiatives to improve those. It also provides a really great opportunity for our absolutely fantastic staff.
So ultimately what I'd like to see 5 years from now is an ICS which is really working together in a joined up way, so that we see the breaking down of silos, we see people working in a much more collaborative way, and people really excited by that. And I think that's going to mean that people will actually want to come and work here in South West London, because they're going to be really impressed with the things that we're doing for local people.